Hello, my name is Hannah Cooper and this is my video submission for BEH 1011 Communication and Clinical Skills on 78-year-old Mr. Jones. I'll be doing a blood pressure, Glasgow Coma score, chest auscultation, and pulse and respiratory rate. This was filmed on the 10th of May with Steve Conlon being my patient. Alright, Mr. Jones, I'd like to check your vital signs. Do you mind if I sit down with you?
No, that's fine.
Thanks. I'd like to take your pulse, Mr. Jones, if that's alright. Can I just hold onto your wrist?
Yeah, sure.
Thanks. And I'll just put my hand up there if that's okay. Thanks. Okay, I've located a radial pulse. I'm going to palpate the amount of times his heart beats in 30 seconds and times that by 2 to get a heart rate. If it's irregular, then I'll take it over a full minute to get a more accurate reading. With my left hand, I'm measuring the amount of breaths he takes over 30 seconds and timesing that by 2 to get his respiratory rate over a minute. If that's over 16 or it's irregular, then I'll measure it over a full minute. Alright, thanks Mr. Jones. That was a heart rate of 80. Is that normal for you?
I think so. I haven't had none for a while.
Oh, okay. And your respiratory rate was 14 breaths in a minute. Do you ever have difficulty breathing?
Sometimes, but it's not too bad.
Oh, okay. Well, thanks for that, Mr. Jones. I need to have a deeper listen to your chest if that's okay.
Sure.
Thanks. When I was taking Mr. Jones' pulse and respiratory rate, I used the non-verbal communication techniques of eye contact, touching him to reassure him, and facial expression, looking interested, and open body language. Okay, Mr. Jones, I'd like to listen to your chest now, if that's okay with you.
Sure.
Did you mind leaning forward for me a bit? And could you cough a couple of times and take 2 deep breaths? Thanks for that. I've just gotten Mr. Jones to cough twice to clear any sputum that might have been in there and give me a false reading, and take a couple of deep breaths to open up his air sacs. I'm going to listen to his lungs going from the apices to the bases and comparing the sides to one another as I go, listening for air entry and any signs of noises like stridor, wheezing, or gurgling. And I'm going to measure 10 points. Right, thanks for that, Mr. Jones. You can relax now.
No worries.
That sounded pretty good to me. During the procedure of chest auscultation on Mr. Jones, I used the non-verbal communication techniques of touch to reassure and an open facial expression and body language, and utterances like saying okay or mm-hmm. For the purposes of that skill, since we were just acting, I didn't take the shirt off or go under the shirt. Okay, Mr. Jones, your chest sounded fine. Are you alright if I take your blood pressure now?
Sure.
Thanks. I'm just going to put this on here, and it'll feel a bit tight when I pump it up in a minute. And can I just get you to turn your arm that way? Thanks. Sure. Okay. I've palpated a radial pulse for Mr. Jones. I'm going to slowly pump up the blood pressure cuff until I can no longer feel his radial pulse, and then go 10 higher. I'll slowly release it then until I can feel the pulse again, and the number on the dial will be his palpated systolic blood pressure. Then I'm going to auscultate the brachial artery as I pump up the cuff and pump it up to 30 above what my reading for the palpated systolic blood pressure was, and then slowly deflate it. And when I hear the Korotkoff sounds, that will be the systolic blood pressure, and when they disappear, that will be the diastolic blood pressure. Okay, Mr. Jones, thanks for that. I got 120 over 80. Is that normal for you?
Yeah, I think so.
All right, thank you very much for that.
No worries.
Now we'll try and figure out what we can do to help you out.
Cool.
When taking Mr. Jones's blood pressure, I use the non-verbal communication techniques of touching him to reassure him and looking him in the eyes, and having an open facial expression and open body language. All right, Mr. Jones, I just need to ask you a couple of questions if that's all right.
Yeah, sure.
Yeah, they sound a bit weird. Do you know what that day is today?
Friday.
And do you know what month it is?
May
And do you know what year we're in at the moment?
2013.
And where are we right now?
In my house.
Awesome. Could you just reach up and grasp my fingertips?
Sure.
Thanks. Eyes. He responds spontaneously to my voice and movements. His verbal responses to my questions indicate he's oriented to time and space. So that's a 5 for verbal. And his motor responses, he reached up and grabbed my fingers when I asked him to. So he responded on command, which is a 6. And that makes a total of 15 for his GCS. While I was obtaining a GCS from Mr. Jones, I used the non-verbal communication skills of eye contact, sitting down on his level, touching him to reassure him, and open body language.